COVID-19 was a prime example that the longer an outbreak lasts, the more lives are lost. This, according to health experts, can be prevented if countries are able to tackle an outbreak within the first 100 days.
So once the characterization happens, those that develop vaccines, we need to quickly work in the lab and put together a vaccine that disrupts its ability to harm us, or somebody who's developing a drug needs to do that. Once that's done, we then need to have across the world a network of producers of vaccines or drugs that have the capacity to quickly start producing this ingredient. Somebody must write the chemical formula to make the ingredient. They need to test if they can. Once those tests are done, they then produce it in mass.
The G20 countries admit that the 100-day mission target is ambitious. However, they believe access to life-saving medication is paramount.
The key thing about the 100-day mission is it needs to have two fundamentals. One is speed, and as important is access. The 100-day mission, as I've pointed out, will not succeed if you just look at developing vaccines, other medical countermeasures with speed, and people don't have access to it. Then it's a failed mission. So it has both those core elements, and we certainly at the G20 have agreed that that's the way to proceed.
The financial ability of developing countries would also need a boost.
We are having a similar session with the ministries of finance for what we call day zero surge financing. If we had an outbreak tomorrow, the finance departments of each country must be able to have a plan of where will they get the money from. We can't be having a conversation at that point about looking for money. We must know where that money will come from.
The G20 Health Working Group has vowed to support each other to make the 100-day mission a success. Nerea Hlakotsa, SABC News, Johannesburg.